Okay, so this is a sort of a part 2 to the lecture video, and I'm going to do these weekly as a way for you to get a more realistic feel because we aren't using cadavers, obviously because we can't be in the labs, but get a more realistic feel, a more 3D kind of a spatial organization of where all of the structures that we talked about, how they fit together, and better appreciate the overall anatomy of these structures. So I'll talk about the eyes, the ears, and then some of the muscles that we talked about this week. And these are short videos, so I'll kind of stop them and talk about the important structures. So here we can see the orbicularis oculi muscle. And as I mentioned before, this is that circular muscle that is around the eye. That's important for closing the eyes. We can see parts of the temporalis here on the lateral aspect of the head, the temporal region. As we strip this away, we can see some of the inner muscles that actually move the eye, the ocular muscles, the inferior oblique, the inferior rectus, the lateral rectus. We can see parts of the optic nerve here, and the sclera, which we spoke about, the white of the eye here. And I want to kind of stop here so we can get a better appreciation of where some of the skull bones fit with the eye. So this is the maxilla here. We've got parts of the ethmoid bone, which is the central part of the skull, right? The nasal cavity region. And then here in the lateral aspect, we can see the eyeball, we can see the optic nerve. Okay. Here's another view that looks more closely at the muscles. So again, looking at some of the bones that and where they kind of fit, we've got the frontal bone, we've got the zygomatic bone, and we've got the maxilla. These are the three bones that are really coming together to form the orbit of the eye. If we peel some of the subcutaneous tissue away and some of the other muscles, we can see the levator palpebrae superioris, right? Remember, this is the one that's going to the eyelid and not so much the eyeball. We can also see the lacrimal gland here and the lateral rectus muscle. Right, and as you peel some of those bones away, we can see the lateral rectus more clearly. Again, the lacrimal gland here, the upper outer corner of the eye. We can see the inferior oblique muscle underneath here. The nasolacrimal duct, remember I talked about the nasolacrimal duct connecting from the lacrimal sac, which drains our tears right down into the inferior meatus. Right, so we can see a better view of that nasolacrimal duct here, which communicates to the nasal cavity. And that is going to be formed by the lacrimal bones, if you remember the lacrimal bones from one of our previous units. On the medial aspect, we can see the medial rectus muscle, again, the inferior oblique, the levator palpebrae, which runs over top the superior rectus. And then I want to point out the difference between the superior oblique, the superior rectus, the levator palpebrae, which is just being removed here, and then the medial rectus, okay? So the superior oblique is this muscle that's in between the superior rectus and the middle rectus. So although we're talking about it as being superior, we want to understand that it's kind of more on the medial aspect of the eyeball itself. So it's in between the medial rectus and the superior rectus. So here's a better view of that, right? That superior oblique. We can see parts of the ethmoid bone here. We can see parts of the optic nerve posteriorly here. And as we continue to peel those layers away, we can get a better view of all of those muscles. The superior rectus, right? The levator palpebrae has been removed completely. The superior oblique, this kind of pulley-like muscle. The medial rectus, the inferior rectus. And these are held together by this ring, which inserts them on the posterior aspect of the eye and kind of wraps around the optic nerve. Let's get a little bit deep into the internal eye structures. We talked about the 3 layers of the eye. We've got the outer fibrous layer, which is the white of the eye, is formed by the sclera. We can also see the cornea here, which is the transparent part of the eye that's anterior, which allows light in. And as we kind of shed those away, we can see some of the deeper structures. So the choroid layer, if we strip away the entire fibrous layer, the sclera, we get to this choroid layer, which is the vascular layer. This has the vessels that nourish the eye. We can also look at the anterior chamber, which is anterior to the lens, anterior to the iris. And then the ciliary body, remember I mentioned that the ciliary body and the ciliary muscle are basically a modification of the choroid. So the choroid kind of becomes the ciliary body as it gets to the cornea. If we strip that away, we can then look more internally at the iris, the colored part of the eye, and then the sensory layer. So if we strip away the choroid, the innermost layer is the retina, or the sensory layer. And we can also appreciate the pupil here, which is that black hole that really brings the light in. Okay, so we strip away the iris and now we can see the posterior chamber. So remember I mentioned that the landmarks for the posterior chamber are going to be posterior to the iris, but anterior to the lens, okay? And then we can see here, continuing on, the vitreous chamber or the vitreous body, which is basically the bulk of the internal part of the eyeball. Again, the vitreous chamber is helping to keep the eyeball patent and open. So those are some of the eye structures. Let's look at the ear structures. So we start off by looking at the outer ear. We talked about this being the cartilaginous kind of movable part of the ear, the pinna, sometimes called the auricle. And if we kind of strip that away, we get into the bony parts of the skull, the temporal bone. We can see the auditory canal here, which communicates that sound from the external ear into the middle ear. Righty. And then just to pause here, we can see the external ear. We can see the middle ear, also called the tympanic cavity. And then we can see the inner ear, which is the labyrinth. This is the eustachian tube, also called the pharyngotympanic tube. This is that ear-throat connection that I talked about. So this connects to the opening into the pharynx or into the throat. Let's talk about the breakdown of the inner ear. So we've got the labyrinth, and I mentioned the 3 parts of the labyrinth, the semicircular canals and the vestibule. Both of these components are responsible for our vestibular function and balance. And then the cochlea, which is this kind of spiral shaped component of the labyrinth, is what is responsible for hearing. And these 3 structures together form the labyrinth, or the bony labyrinth, or the inner ear. Here we get a little bit closer into the middle ear. So the tympanic cavity, also called the middle ear, really only has 2 important structures. It has the ossicles, which are the tiny bones that I mentioned. Here they go, so you can see them a little bit clearer as we strip away other structures. The malleus, which is touching the eardrum. So the eardrum, also called the tympanic membrane, touches the malleus or the hammer. The malleus touches the incus or the anvil, and the incus touches the stapes or the stirrup. And then the stapes touches the oval window, which we can kind of appreciate from this view, and the oval window is touching the inner ear, as we can see here. We also want to point out that the tympanic tube, the pharyngotympanic tube, is also a component of the middle ear. So this structure here is the middle ear again. This is the inner ear, and then this is our outer ear. Okay. And as we bring back some of these bony structures, we can see some other landmarks that we talked about in previous labs. So here's the mastoid process of the temporal bone. Right? Remember, these structures are really embedded deep in the temporal bone. Here we can see the pharyngotympanic tube for reference again, the posterior view of the auricle or the pinna here for reference again, and parts of the temporal bone, the mastoid process here. And as you put some of those structures back on, we can see the temporomandibular joint, right? We can see parts of the zygomatic arch here. This is the mandible. This is the temporal bone. Okay. All right. Last, let's look at some of the muscles that we encountered this week. So muscles of the so let's talk about some of the craniofacial muscles here lastly. First off, we can see orbicularis oculi, right around the mouth. We can see orbicularis oris, right around the eyes. As we strip away some of these subcutaneous layers and skin, we can see parts of the temporalis. Okay, we're gonna see some muscles that aren't relevant to us, but I'll point out the ones that are. We can see some of the facial muscles here that I talked about. So again, orbicularis oris around the mouth. We can see parts of the masseter over here. We'll probably see it a little bit better on this side. We can see the nasal bones here, some other structures. We can see the orbits of the eyes, the zygomatic bone here, the zygomatic arch, parts of the temporal bone, the masseter, and then the deeper buccinator. So one way to kind of distinguish these two muscles is their different orientation. So the masseter is running up and down, kind of vertically oriented, and the buccinator is going to be more horizontally oriented, as we can see here. And then we can see a bit of the temporalis over here as well. Alrighty, some other landmarks that we should be familiar with: the styloid process of the temporal bone, the internal acoustic meatus here at the opening that is continuous with the external acoustic meatus. Yeah, again, the zygomatic arch, the mandible and the temporomandibular joint, or the condylar process of the mandible, which articulates at the temporomandibular joint. Some of these muscles we'll talk about later on as we get into the second part of the head.